If you live right here in Brooklyn, and you need a interlisten, no problems too big or small, to want to eat them all. I tell her,
Straight up, tell Stella. Straight up, tell Stella. Straight up, tell Stella. Straight up, tell Stella. Tell Stella.
This is Straight Up out of Brooklyn. I'm Stella Winston. The Sickle Cell Thalassemia Patient Network is an organization that assists people living with sickle cell. My guests are two members of that organization, Francesca Stevens, who is the youth coordinator and fundraiser for the Sickle Cell Thalassemia Patient Network, and also I have T. Ginger Davis, who is an advocate for the organization. I'd like to welcome both of them to Straight Up. Welcome.
Thank you, Stella. Thank you for having us.
Well, thank you. Thank you.
How are you?
Okay, good. I'm glad you made it. So, the question, I'm going to start with an information question. We need to be educated. I remember hearing about sickle cell from a little girl, but I was never clear on what sickle cell is in terms of how it affects a person. Can you explain sickle cell?
Yes, it's a genetically inherited blood disorder. So it affects the red blood cells and is passed on from parent to child. Both parents, both the mother and father, have to carry a trait for sickle cell disease, and that can be passed on to 1 in 4 chance for it being passed on to any child in any pregnancy. So, it's like a crapshoot, whether or not your child will get the disease or have the trait or nothing, depending on what the parent's status is.
So what is the nature of the disease? When someone has sickle cell, what type of condition does the body have, or what does it go through?
Well, because it's the blood, every organ system, every inch of your body is affected by this disease. Basically what happens, the hemoglobin inside the red blood cell that carries oxygen is the part of the blood cell that's affected by the genetic mutation in this, and it's developed over centuries as a immune response to malaria. And what happens is the red blood cell sickles when the hemoglobin misshapen, so it turns the round, soft, pliable cell into a sickle-shaped mass that can't go through capillaries and small veins, and what happens, it blocks the circulation of blood flow through small blood vessels, and it can happen anywhere in your body. It can happen in your legs and the muscles and the bone. It can happen in the organ. Persistent crisis like that in the organ, what we call crisis, is when the cells start to sickle. If it happens in the organ, if it happens in your brain, basically you're having failure in those organs. So when it happens in the brain, it's a stroke. If it happens in the heart, you're having a heart attack. In the lungs, it's like a pulmonary embolism. So it can happen anywhere in the body at any given time. Predominantly it happens in the muscles. There are times when it happens in the bones. And what happens is it cuts off the flow of not only circulation of the blood, but also of oxygen to those tissues. So you get what's called ischemic damage, where the tissue loses oxygen. Now, as long as you can get the circulation to start flowing again, oxygenated cells can pass through the lungs and come back and bring oxygen to those areas. But what's end up happening, over the lifetime of somebody living with the disease, you start to have a breakdown in organs or in the bones, like your hips. You have what's called avascular necrosis, because the bones in the hip are dying and eventually need to be replaced. You can have kidney failure, damaged liver. Pretty much it's a very destructive and pervasive disease.
Now, you mentioned that it was a result of centuries of a body fighting malaria. So it's like the body turned on itself. To fight malaria would be a good thing for the body.
No,
So
actually, I wouldn't consider it as it turning on itself. The mutation happened from a genetic level, so it really happened from the amino acids that make up the genes, and what happened, 2 amino acids just switch place. And what happens physically to the cell, when a person has malaria, it's a virus that's introduced from an insect bite. It goes into your bloodstream, and then it starts to go into the red blood cells. They replicate in the cell, and then they break out in the cell, and new viruses go out. They find more cells, and they replicate, and they break the cells. Now, every time a cell is broken, it doesn't get repaired. It's destroyed. With malaria, with somebody who doesn't have an immunity to it, they suffocate pretty much to death within a week because all the red blood cells, which carry the oxygen throughout the body, is being destroyed. When you have sickle cell trait, malaria doesn't take hold in the body as it does with people who either have sickle cell disease or who do not have it, because the cells with the sickle hemoglobin will start to sickle, and they destroy the virus with that cell that gets destroyed, so it doesn't proliferate as quickly as it does with someone who has a disease. It's a fallacy that if you have sickle cell disease, you don't get malaria. That's not true. You can get malaria, and it kills you faster because, yes, unfortunately, what happens is people with sickle cell disease do not produce red blood as fast as someone with normal hemoglobin. And when a cell gets destroyed, it takes that much longer to have that cell replaced, and so your body is always working with a deficiency of blood volume. So that's what the anemia comes from.
Okay, sickle cell anemia, because I often heard that word associated with it. So having sickle cell, living with sickle cell, now both of you live with sickle cell. I failed to mention that. Both of you live with sickle cell. Does that make you more susceptible to other diseases or problems or health problems as a result?
Not necessarily. Your immune is you sometimes have an immune deficiency because of your body's inability to produce healthy red blood cells. You need that to heal yourself. So sometimes you may pick up viruses and colds faster. We deal with a lot of pneumonias and acute chest syndromes, but it doesn't necessarily mean that we are going to pick up other diseases faster than other people. It just means that we have to be more careful with the way we take care of ourselves and the way we treat our bodies and try to replenish our bodies and get the kind of rest and the nutrients that we need to build back our bodies so that we can live healthy, productive lives.
Now, Francesca, you are the youth coordinator.
Yes.
And your role is to educate the youth or to help guide them with how to live with sickle cell.
Right.
What are the main issues that you have to deal with young people and dealing with sickle cell?
A lot of the issues we talk about have to deal with how we handle relationships, forming peer bonds within school and with the people in our lives, friends and family, and also when they get into adolescence, how they form healthy love relationships. Those are a lot of the issues that we deal with, and we also talk about ways to cope with having this disease and going to school and, starting to live our lives independently from our families while still coping with the disease. A lot of the issues we deal with really in terms of peer groups and patient support really does not have to do with the medical aspects of sickle cell disease, but more like the psychosocial aspects of the disease. And so those are the issues I deal with on a day-to-day basis.
Now, give me an example of both of you growing up with sickle cell. How did it? You mentioned social relationships. How did it affect, let's say, your friendships, your love interests, just your immediate family? How did it affect you? Give me an idea of what you went through.
Well, I'm going to happily date myself. I grew up during a time where not much was known about sickle cell disease. So I grew up with a lot of question marks. And I'm actually the second of 5, the classic second of 5, who was born with the disease but the only one to survive. So my mother was very paranoid about my well-being. I was very much sheltered, overprotected, which I constantly rebelled against. Sorry, Mom. You know, I say sorry to her about that all the time. But I was always determined to live life on my own terms.
So you were rebellious because she was so protected, but she's trying to protect you so
Right.
that you would not
What I
suffer
don't
from...
mean rebellious in a problematic
No,
way.
but-
I mean that I was always told you can't do this, you
Right.
can't.
Like,
play,
for instance,
you
what
can't
could
go.
you not do?
There really wasn't anything that I couldn't do. I was very athletic. The things that triggered me getting sick was being exposed to cold, prolonged cold. Like if I was in a room where the ambient temperature was lower than 70 degrees, eventually I would start to feel pain. Cold water, you know, I had to be careful about swimming in the summer. I couldn't go to the beach early in the season, had to be later. Couldn't be in cold water. Certain food combinations also triggered crisis for me. And I became a vegetarian and a vegan at one point because I just would not touch any meat.
Really?
And that was like one of the biggest triggers for me. And I couldn't eat meat like with red beans, and I come from a Caribbean family, so there was always red beans and pigeon peas and rice around, so I couldn't eat certain foods in combination. I knew it would immediately make me sick, you know, before the end of the day. But in terms of my relationships with, you know, my mom, I knew very early on that she was afraid for me, so I didn't really give her problem, but when she wasn't looking, I did everything she said I wasn't supposed to do. I played, I climbed trees, you know, I went out to camp, and I knew what my limits were. So, and I knew that I was feeling the pain, so I was careful, like I wanted to have fun, but I didn't want to get sick and go in the hospital because then that meant I missed everything in my life. School, going out to play, my friends, things of that nature. As I got older, I started to experience a remission and symptoms. So I had gone for like 5 years through high school without getting sick, and then suddenly one day I had a crisis, and I remember, oh yeah, that's right, you have sickle cell, right?
Oh, you had
And
forgotten.
yeah, and
That
I was
a good
like
thing.
dating the cutest guy in school who became the track captain, and it just like, you have to tell him. And he was very supportive. I mean, there were other people who were like, oh, she's, you know, going to get sick. And at the time, if you remember, Sidney Poitier did the movie The Warm September, and that was everybody's perception about sickle cell because that was the only imagery that was being produced.
Refresh my memory.
Warm
Warm
September, an African princess actually came with her father, who was a diplomat, to London. And Sidney Poitier was a physician, and he had met her. They fell in love. She didn't tell him she had sickle cell disease, and she had gotten sick. And he was caring for her, and basically it was time for her to leave with her father, and she wanted to stay. And the father basically says, "You can't do that. You know that you don't know when this disease will kill you, and you don't know when. And he's already lost a wife. You don't want to torture him." And unfortunately, you never know when your time is up. And because there was nothing really much known about the disease, we were not given very good life prognosis. I think I was told maybe about 10 different times that I was going to die. I wasn't supposed to live past 5. I wasn't supposed to live past 10. I wasn't supposed to make it past 16.
16 is the age we all get.
18, I was going to be paralyzed and barren. I have 2 very healthy children.
Oh, good. Wow.
And, and I've lived a productive life. I've traveled. I'm back in college again now, changing careers.
So what does that do to the psyche to grow up with someone giving you like a death sentence or like your time of death is going to be such and such? How does that affect you and how you live your life?
Well,
I'm sure everyone is different, but
Yes.
let's hear from you.
I guess it really depends on the kind of support system you have at home, because I know that I had a great support system. My dad was someone who was very fearful. He didn't want me to do anything because I was going to get sick. Like if I walked on the floor, I was going to get sick. So he didn't want me to do anything. And my mom, in a lot of ways, was the same way, but when I was 12, thank God, I met Ginger, and she started talking to my parents, and they loosened the reins a lot, and they let me live. And like Ginger, for a while during high school, I stopped getting sick. and then I went to college and started up all over again. So I, like Ginger, had this thing in my mind where it was totally out of my mind, and I was normal, and I lived my life, and you couldn't tell me I was sick until the day I got sick, you know, and then that's traumatic to realize that you're sick again and have no medication, be out in the street, and it's a tragic thing.
Really? So what happens? You like what? Do you get?
Sometimes
It's panic stricken. I do it to myself now. Like there are times when you'll go so long without being sick that you stop worrying about the medication. You stop worrying about doing all of the things that you need to do to keep you healthy, and then all of a sudden you get sick, and you start to panic at times.
If you're more conscious about your health, what you eat, how you exercise, the air you breathe, the water you drink, does that lessen the number of attacks that you have?
Yes.
So would you say that people who live with sickle cell are healthier people? Like they?
No.
No.
Listen, our jobs are very hard.
Okay, so let's talk about the job, because that's why your organization exists.
Yes.
The Sickle Cell Thalassemia Patients Network, to help people to learn to live with the sickle cell.
Let me tell you something.
Yes.
This young lady has come a long way.
Really? Tell me something about her.
My thing is, you know, I don't like telling people what they're supposed to do. It's not my place to tell anybody what you need to be doing. All I can do is share information. And I also try to live by example. And I've had people say, oh, she doesn't have sickle cell. I don't know why they're saying that. There's nothing wrong, because they don't see me sick. They don't see me in the hospital. I'm deliberate about being healthy. And I know what my triggers are, and I stay well away from that line where if I keep doing this, I'm going to get sick. You know, like stress is my main trigger now as an adult. Food doesn't really bother me so much anymore, and I am careful about not doing, you know, eating the foods that I think will make me sick. I have built a tolerance to the cold, and that's really from my participation in martial arts and yoga and other athletics. I've been able to, you know, raise my body temperature and my resistance to the cold. So that doesn't really bother me so much anymore either. But I am a very driven person, so I can work around the clock and not sleep and pretty much exhaust myself, and my body will start to warn me. All right,
so you have to remember
to down a notch.
To rest. Rest is also a very important part of health.
Right, and the majority of our population are caught in what we call the sickle cycle. They're just waiting for the next crisis to come, for them to be sick, to go in the hospital, and for somebody else to take care of them until they're well enough to be, you know, to fend for themselves. I mean, at this point now, the hospitals don't keep you anymore. They're trying to throw you out in the third day of you being admitted.
Exactly.
And so people are leaving the house not fully recuperated from a crisis, and they're just stuck in this cycle of sickness. And it's driven by the psychological effect of this disease, of your body being weak, of you not being in control of your strength and your health. Now, there are mitigating circumstances in some cases. You have people with a very high degree of sickling, and because it's a percentage game, and also there is more than one gene associated with the disease. So depending on what your combination is, like SS is classic sickle cell anemia. Then you have S beta thalassemia, SC disease, SF, and those are considered to be milder than SS. The pain is no different. It's just that you may not get as sick as often with thalassemia or SC as you do with SS. And people with SS really have no buffer, and they're at the mercy of their blood. Really. And I mean, you could be laying down in your bed sleeping and wake up sick, doing on a beautiful sunny day, did nothing and wake up in crisis. So the first time that happened to me, I promised myself I was going to earn every crisis I ever had.
Amen.
What do you mean earn every crisis?
If I'm going to get sick, I'm going to get sick doing
what I want to do.
I'm going to live my life. So I go, you know, hiking in the mountains or mountain climbing and kayaking and skiing in the wintertime. And the only thing I really don't do is, like, I'll wet my feet at the beach. I'm not much of a swimmer, but I do everything else. I've done martial arts. I've, you know, whatever it is.
So when, as an organization, when you advocate or you educate people who are living with sickle cell, What are the overarching guidelines that you give them so that they can live a happy, healthy, fun life?
Well, first and foremost, educate yourself. Learn about the disease that you're living with. Educate yourself, get familiar with your routine and your body. Learn the triggers that bring on crisis. Also, educate the people around you, because there are a lot of times when the people around you can add to the stress that that brings on crisis. And
give me an example, for instance. Smoking cigarettes? No?
No. Well, with friendships, I know when I was younger, I had to really educate my friends. They wanted to do a lot of things that I couldn't do, and I wasn't strong enough to say, I can't do this. I need to take care of my body. And so if you educate the people around you to know what you're living with and what are your triggers, and I need you to help me to stay healthy, you know, then it helps to avoid some of the crises that can come on.
Now, through your organization, you have a walk in Central Park every year. How long has that been going on, and how has that helped to get the word out and to educate?
The walk has been happening now, I believe, 19 years.
Wow.
It helps mostly with fundraising, and we do get to disseminate some materials in and around the time of the walk, but it really helps with fundraising because we also have hardship program and scholarship program, and we also need to bring funds into the organization so that we can keep on educating people within the community and providing the other programs that we provide, seminars and forums. So that's really the primary focus of the walk, is just to get the word about the organization out there and to help to bring funds into the organization so that we can continue to provide the services to the community.
Yes, because we do a lot of things free.
Right.
And people come to the organization in need when they have nowhere else to turn, whether it's, you know, someone needing to pay the rent, replace their ID, pay for a funeral, and and you know, they come to the organization, and the SCTPN never says no.
Right.
So the walk primarily is, I mean, we use most of the funds for scholarship,
Right.
but it's to do the free public education and also to provide for the needs of the families when they have nowhere else to turn for assistance.
If you are diagnosed with sickle cell, what does that mean in terms of the cost of health care for a family or for an individual? What does that mean in terms of the cost that you have to bear as a person living with sickle cell?
Usually the individual with the disease doesn't bear any cost.
Right.
It's very expensive when you are in a cycle of constant illness. Your medical bill can be anywhere from $50,000 to $100,000 a year, from hospitalization, from the treatment that you're receiving, from the constant tests to follow, you know, your blood counts, the x-rays, you know, whatever it is that you need for care. And then once annually is something that I've been working with the doctors to recommend, and there's some doctors who follow the protocols and others who don't, and that is to have an annual head-to-toe physical for the patient. With the children, they have to do it because they're finding a lot of children are prone to strokes, so they do cranial Doppler every year. They do, you know, testing the lungs, looking at the internal organs, doing bone density tests, things like that. So checking the eyes.
Checking the eyes.
You know, because you can lose your eyesight to this disease as well. If you have sickling in the in the ocular vessels, you can lose your eyesight. So it's similar to what happens to diabetics. So it can be very expensive, and that's all the more reason why individuals need to take responsibility for caring for themselves. What also happens is a lot of the times, you know, you start out with a 2-parent household, and the minute you get this diagnosis, one of them is leaving, and you can hazard a guess to which one who leaves.
Right.
So you have a lot of single mothers dealing with children on their own, and they try to work, and it's very difficult because when a child gets sick, you have to leave the job to go take care of your child, take them out of school, meet them at the hospital because the school got the child to the hospital, whatever the case is. It's very hard. So there's a struggle to remain employed and gainfully employed. You have households on Medicaid or Medicare, on public assistance. So you're talking about families in a cycle of poverty.
Okay, we're coming to the end of the show, and I want to give you the opportunity to talk a little bit about the organization and what you would want to say to the viewing public in terms of what you have to offer.
I know a lot of the information that we've provided sounds very disheartening. It sounds very intense and everything else, and it can be, but it's not a death sentence. It's a chronic disease, and in some cases it can be terminal, but Fran and I are here as examples of living healthy with this illness.
Look great. Oh
and
my
even
gosh,
in pain,
beautiful.
we still function. Life is what you make it, and aside from learning about the disease, the next most important decision that you can make to be healthy is decide to be healthy.
Exactly.
And then to do it. And not to let this is a small part of your entire existence, and don't let it be your defining part. The organization was founded by adults with this disease, and everybody's had their struggles. We've lost people along the way, but we would never discourage somebody who was, prenatally diagnosed that your child may have sickle cell disease to not have that child, because you never know what it gives. And I know the disease has strengthened me as an individual, and it has encouraged me to live life to its fullest. The organization, as long as there's somebody with sickle cell disease, and there are over 300 million people worldwide living with this disease, we're going to be here, and we're going to be here to help.
Francesca, you want to add anything to that?
Like Ginger was saying, I've learned over the years that this disease is my blessing and my curse. Yes, I suffer a lot, but I am mentally and emotionally strong, and I don't know that I would be the person that I am today had I not been diagnosed with the disease and gone through the things that I've gone through. And it's taken a long time, but I like the person that I am, because I know that I've conquered things that other people could never begin to imagine. And so that's what I really learned being a part of this organization, that I'm not the only person that's suffering, but I can rise above my suffering and live my life to the fullest.
Well, I want to thank both of you, Ginger and Francesca, for coming on Straight Up and sharing so much about a disease I really didn't know that much about. Okay.
Right.
Thank you again. Thank you, Francesca.
You're welcome.
Thank you,
Thank
Ginger.
you.
Tell Stella.
Tell Stella.